Good day, everybody. This is Waldo Michaels Carrasco with the Illinois Public Health Institute and Data Across Sectors for Health. And I want to welcome you all to today's program. We're just going to give a couple of minutes here for folks to virtually file into the room, and then we'll get going. All right. Well, again, I want to welcome everyone to today's program. My name is Waldo Michaels Carrasco. I'm with the Illinois Public Health Institute and Data Across Sectors for Health. And I want to welcome everyone to our first installment in a three-part webinar series, Advancing Community Health Through Equitable Data Ecosystems. The webinar is a series that introduces the DASH framework, which highlights the key domains of shared multi-sector data landscapes and will help guide communities to leverage their data ecosystems for equitable systems change. This first session will focus on building foundations with community, and our panelists are DASH-funded communities who will be discussing the challenges and complexities involved in relationship building. We'll have opportunities for establishing relationships among partners with the community. So let's move on to our housekeeping slide here. All right, many of you have been using Zoom, so some of this might be old hat, but for today's presentation, we will have ASL interpretation available. So if you need those services, please have your screen view set to speaker view to view the speakers and interpreters. Spanish interpretation, you can use the control panel to change your channel to English, from English to Spanish. And we're gonna ask that we have both the chat and the Q&A module available on your screen. So please use the Q&A to ask questions of the presenters. And if you wanna make comments to go with the discussion, feel free to use the chat option for that. And that way everyone can see what your comments are with the discussion. Please use the hand raising feature to come off mic during the Q&A session at the end. And if you do have need for technical assistance, Susan Martinez from the DASH staff is available, and you can message her or chat her directly at Susan M. Dash in the chat function there. So let's move on to our sponsorship slide. So Data Across Sectors for Health, or DASH, as we like to call it, is led by the Illinois Public Health Institute in partnership with the Michigan Public Health Institute. And this is made possible through generous support from the Robert Wood Johnson Foundation. Today's session goals will focus on building foundation and community. Our panelists are DASH-funded communities that will be discussing their experiences with establishing relationships among partners within the community. They'll be discussing the challenges and complexities involved in relationship building, along with opportunities for establishing relationships amongst partners within these communities. And they'll also address what is involved in successfully managing multiple partnerships, such as transparency, collaboration, governance, and balancing power dynamics. Today's learning goals will include identifying the power dynamics influencing individuals and group interactions and communications in their communities, understanding trust building and partnership formation, as interrelated core principles and activities of successful multi-sector data sharing initiatives advancing health equity. And finally, describing how building a shared vision forms the foundation that is necessary for multi-sector data sharing collaborations to advance equity. Next slide, please. So, through awardee insights, our national inventory survey, the All-In network, and through partners, DASH has identified key factors which are important for data sharing and using data across sectors with communities to support more equitable systems that create the conditions for health and well-being. In this latest version of the DASH framework, we dive deeper into how equity as a process and outcomes intersects with data ecosystems and data infrastructure that is built to unlock the power of data ecosystems towards social good. The DASH framework elevates the key domains of shared multi-sector data landscapes and guides communities in leveraging and equitable data ecosystems for change. The framework also includes fundamental components of intersections of data sharing, such as factors that support strong data sharing foundations and recommendation components of data ecosystems that facilitate equitable data sharing. The factors that we've identified relate to building foundations with community, sharing community data ecosystems, the role of policy in multi-sector approach, and equitable systems change. By connecting information systems and sharing data across sectors, but particularly in ways that are community-driven and equitable, meaningful and sustainable community health improvements are possible. Next slide. So data sharing efforts can include very technical elements, from interoperability frameworks to complex legal agreements. To harness these tools to advance health equity, it's important that collaborations begin not with technology, but with human relationships. This piece of the framework that we're going to focus on today sheds light on the key concepts and practices that enhance the quality, impact, and sustainability of data sharing collaborations by sharing power with communities, deepening trust and partnerships, and developing a shared vision. So let's look at a couple of those. When we're talking about deepening trust and partnerships, what we found and the communities have shared with us is that it takes time. It involves clearly defined partnership roles, and it requires transparency. Where they shared about sharing power with community, we learned that it can prevent unequal power dynamics to persist, that it must be a commitment of multi-sector collaborations, and that it allows people with lived and living experience to have decision-making power. And finally, in developing a shared vision, it builds a strong foundation for collaborations seeking to advance equity, is a process and an outcome, is iterative, and that it's anchored in trust building and power sharing. So to provide real world lived experience of how we developed this aspect of the framework, today in this first session, we'll be focusing on building foundations with community. Our panelists from DASH funded communities are here with us to discuss the challenges and complexities involved in relationship building and opportunities for establishing relationships among partners within the community. Our speakers today will be Yvette Guillermo Magahi, founder and executive director of Allies in Caring; Elisa Orona, executive director of Health Improvement Partnership of Santa Cruz; Eva Holt Rusmore, project coordinator of Data Share Santa Cruz County; and Sarah Adler, website analyst with the Data Share Santa Cruz County. So Yvette, I think you'll be kicking us off.
Thank you. So I want to say that it's an honor for me to have been invited here. And I'm here also representing the other coalitions that I have helped co-initiate. That is the Hamilton Health Coalition and the Deaf and Hard of Hearing Coalition. And I want to give you a little bit of context of the work that Allies in Caring does and how that is relevant for what we have learned about data collection and the power of data and how why data matters for change and for advancing health. So Allies in Caring is a behavioral health organization. We provide counseling and we work with families who are, have experienced trauma, and families with disabilities, who have members with disabilities. And in our work as a counseling agency, we have learned that the relationship that we build with the family, we provide family therapy so that, and the family is kind of a system too. And so it's, there is a similarity between what happens in the system of a family and the larger community. And so this, in the family system, the information that is shared by the members of the family, if it's accurate information and if we get a complete picture and if it's a valid information that the members of the family are willing to share, then we can actually help the family with our interventions. But if when the members of the family don't feel comfortable sharing their information and they withhold information, then it's very difficult to actually support the family in their healing process or the change that they want to make. So what we have learned is that really creating an environment of trust and helping members of the family feel comfortable sharing what is happening in this puzzle, each contributing their piece, that helps them with change. And so it's similar to what we have learned in our work with the Hamilton Health Coalition. So Hamilton is a rural town here in South Jersey. And we have a lot of immigrant communities who work in the farms, and many of them are living in poverty. Many of them, as immigrants, have experienced trauma while they come into this country. And so our goal with Hamilton is to advance health in our community. We have been a segregated community, so we wanted to improve our health also because that impacts the safety in the town. It has an impact in the school system. So we are a cross-sector collaboration. And with the Deaf and Hard of Hearing Coalition of South Jersey, we have the same goal, but just focus on supporting deaf people in advancing their health. And in both coalitions, if I can move to the next slide. So in both of coalitions, our work has been to foster collaboration so that together we can improve the physical and psychological health of our community members. And we are implementing creative programs. One of the strengths of our program is a connectors or leadership development that we have. We identify members of our community that are leaders already that help us with our whole data ecosystem. So I want to talk a little bit about our data ecosystem that we have leveraged. So the system that we have been very thoughtful from the beginning in thinking about what is the information that we want to collect. And we purposely decided that we did not want to just collect information about problems and needs that people have in our community. From our experience with as a mental health agency, we know that it's very important to also inquire about the strengths, like and the talents and the resources that already are present in families and in the community. And so we have leveraged that process even from deciding what is the information that we are going to collect, because that data that what we have discovered, like the talents that already exist, the resources that already exist, though we can leverage those for our interventions or what we decide to do together in the community. Then we have also leveraged the process of collecting information. So we know that when like what we have seen is that when we are collecting information, the way that we do it, as you can see from this picture and other pictures that you'll see in the next slide, we collect information by creating these convenings where there's a very important focus on building genuine relationships. So we don't want to kind of just use people for our own purpose. That many times at the beginning, just historically, we have heard from communities of color that they feel that they have been commodified or utilized by, they have been used by others who come and do surveys and do analysis and investigations and create a study and report it to whatever organization, and then nothing happens to the community. There's no real contribution or change or a commitment to reciprocate their time. So we have been paying attention that as we collect information, we are building a relationship, and we are making sure that we are going to reciprocate for the time, and we are going to make a commitment that the information that they provide does not only serve the purpose of a study that is going to stay in a paper, but that is also that actually some action is going to take place after people have provided information. And so, we, in these gatherings that we create, from the beginning, how we reach out to people and how we ask them to participate in these meetings, we also have like food, and we have like all these people that are hosting, because in these meetings, many times we have invited people who are hesitant to share their information because they are afraid. Like in this meeting, we had people who are undocumented immigrants, or people who are maybe don't feel really that they have not felt welcomed in the community, and they are afraid that they will be sitting in a table and they will be sharing information, and they will experience again this feeling of being unwelcome. So we have the connectors that we have as part of our coalition. They really act as hosts for each one of the tables. We have a host, and we, in this case, what you see here is that we use the World Cafe method, that way they sat in tables, and then there's a host, and from the beginning, very thoughtful, welcoming environment. We had food that is culturally also feeding for the people that we are inviting, and so then, as you can see, what is also wonderful in the collecting, how we are leveraging the collecting process, is that as we are asking questions that are not only about problems or needs or issues, but we are asking questions about what are your strengths, what resources do you contribute to the community. In that process of being curious about what's right with the person, we are also helping the person. We see that maybe they were not aware of themselves, their own strengths, but by asking the questions, we start to elicit that, or they can become more self-aware of their own resources, and we are leveraging that. And then when we manage that information, once we have collected the information, we also have created a system. For example, like one of the questions that we ask is that we are interested in identifying is their talents. So, and talents can be talents of their head, their heart, or their hands. So people who, like, for example, like we identify people that are very good at making piñatas or making tamales, but they themselves don't have a job and they would like to have a job. So we created this WhatsApp group where we people can that we help people share their talents that they have, and then that way that became a way of for them to make some income for some of these people that needed to also have add additional income. So I'm just, or even just informal resources that they can share, like somebody is giving away, so exchanging information about their resources of if somebody has time and they can take care of other kids, or somebody has can provide transportation from one place to another because their kids are in a soccer team and they've come. So this kind of information is what we were interested in collecting. All of these advances help because, as you might know, like for many families who are living in poverty, they need to rely on unpaid resources. So that's what we have been able to do with this information that we have collected, that we have expanded the availability of resources for them that are just through their own network. But if we can move to the next slide. So what I want to emphasize is that the information that we collect is only possible because of the relationship that we are building, and it's what we also know as social capital. That think we have been able to collect this valuable information because people trust us, and the trust that we have built with the community is based on paying attention to building a genuine relationship. And when I want to expand a little bit on what is it that this genuine relationship, what are the ingredients for the genuine relationship? So one of the ingredients has to do with like how we relate to them, like with respect, appreciation, recognition of their integrity. So I think that sometimes traditionally, when we have come to people and we have only asked about what's wrong with them, what are their issues, their problems, their needs, we are not respecting their dignity and their integrity. And I can tell you from own experience, because I'm an immigrant myself and my parents are deaf and my siblings. So I grew up with that, like just people were not that interested in our strengths and what we already had, that, but they were more interested in what was wrong or what the problems or disabilities or what was lacking. So, and that it has an impact in people. So it's I find very important to ask about what's right and to help support the sense of dignity and integrity. So that's how we have built this relationship and making very clear the values that we share, and that we are making a commitment to reciprocate. So reciprocating has been also very important. Now the community knows that when we come to them with a survey or with a question, we are going to use that information to benefit them, not just to benefit ourselves. Sometimes, many times, I've seen that the way that information has been used is to get funding, for example. And we are committed as a coalition to, if we are going to get funding, that funding needs to really go and benefit the community and then it needs to be transparent. What is it that we are getting, and what is the information that we provided. And so what we have seen is that now that we have been successful as collecting data, we have power, because other organizations who have seen that we have this good relationship with the immigrant communities, especially now that there's a strong emphasis on funding being allocated for people of color and people with disabilities. Many organizations want to connect with the community, but so we are being very careful to make sure that when we share this information, we get a commitment to reciprocate. And what I find is that the data itself is not powerful. That's what I want. It is the relationship what has made, what has power, because when we have a relationship, we are able to collect information that is accurate, that is valid, that is complete, that provides a complete picture. So I just have 1 more minute for the last picture. And yeah, I'm going to, this is how, like, as a coalition, I think I don't have time, but I can show just the last PowerPoint. If we can go to the next one. This is just one of the visual exercises that we did together as a community, where we together share our dreams, our intentions, our resources that we had, and we did it in English and Spanish. So thank you. I hope this is helpful. Yes.
That was great. Thank you, Yvette. We are going to move to our next speaker now. Ava Holt-Russmore will now present on her portion, and I think Ava will be also bringing in some of the other speakers for the rest of the presentation. So Ava, do you want to take it away?
Thank you, Waldo, and thank you, Yvette. I'm just going to talk a little bit about DataShare Santa Cruz County, for which I'm the program coordinator. And DataShare Santa Cruz County is an interactive platform with local, regional, and national data available to everyone. We envision Santa Cruz County as equitable, thriving, resilient community where everyone shares responsibility for creating the social, economic, and environmental conditions necessary for health and well-being at every stage of life. So this platform fulfills a specific need for accessible, reliable, quality data that can be used for advocacy, community research and engagement, grant writing, reporting, and program evaluation. We're a collaborative organization driven by values and shared goals, which aim to provide equity-centered and comprehensible data about Santa Cruz County to promote informed community action and evidence-based policy. And I'll call in Elisa from HIP.
Thank you, Eva. So appreciate the opportunity to be with partners across the country who are focused on health and well-being for your communities. It is wonderful to be in the good company of you all and to be supported by this fantastic team here at DASH. So my name is Elisa Orona. As Eva mentioned, I represent the community of Santa Cruz County, California, and we're located on the Central Coast, about a couple hours drive south of San Francisco. So just to place us on the map. I serve as the executive director of the Health Improvement Partnership of Santa Cruz County, otherwise known as HIP locally. We are a multi-sector healthcare collaborative, and we're comprised of county departments, both health and human services, hospitals, community health centers. We have one Medicaid health plan in our community, and we have a number of CBO partners that are also part of our initiative that are focused on behavioral health and mental health. We've been bringing together these partners for nearly 20 years to take on systems change, such as creating a children's health insurance plan for our community. We've also tackled the opioid overdose crisis and opioid prescription crisis through a coalition that we call SafeRx Santa Cruz County. And we have been very active in the rolling out of the Affordable Care Act, the Mental Health Parity Act, and just really bringing accessible, culturally humble, and quality healthcare to everyone in our community. And finally, and this is why we're here today, we are all about advancing community health through data sharing. And we've been doing that in partnership with so many wonderful collaborators in our county through the establishment of DataShare Santa Cruz County. So just to give a bit of historical background, so in 2017, HIP had the privilege of convening community-based partners across not only healthcare, although that's like our mission focus, we also are very active with our other CBO partners in social services, our government partners, and other civic sectors to establish data share as a single source of community level data accessible to everyone in our county. And from the start, the process was intended to create not only a product, which was the data platform, but also shared governance and a sustainability model, and really shared ownership and accountability to the community. So as Eva explained, the data share website uses a vendor technology platform that pulls community level data from sources like the census and state public health surveys, and curates that data so that it's specific to our county. And of course, this is really powerful because data share has become the place where people go to find data about Santa Cruz County specifically in a very efficient way. But in our pursuit of maximizing the tool for advancing equity, we recognized that we needed to identify local data sets that tell us a more complete story about the different smaller communities within the larger county. We also recognized that there were existing efforts already in our community, like the Community Assessment Project, which is called CAP locally, which is a historically, it was historically done as a phone survey, and it's been stewarded by our local United Way. And also another initiative that began about the same time that DataShare did, which is called CORE, and this is a county-led collective impact initiative. So these two other community initiatives were underway at the same time that we were kicking off DataShare. So we were honored to receive a 2019 DASH grant, which focused on these two priorities. One being identifying locally sourced data sets to incorporate on DataShare. And we called this prong the Data Inventory Project. And this included a survey focused on identifying data collected by organizations in the southern part of our county so that we could utilize DataShare to give a more equitable data picture of the community. And the second prong was really about aligning the separate initiatives that I described, the phone survey, the collective impact initiative the county was leading, into an aligned collective impact system, where we were looking to leverage the investment and efforts of DataShare along with these other initiatives, and really continue this collaborative process that, as Eva described, was really focused on equity and on telling a more comprehensive story about our community. Eva, I'll pass it back to you.
Thanks, Elisa. Yeah, I think it's important to say a little bit about our geographic place and our social and economic reality here in Santa Cruz County. So if we can go to the map slide, please. So we're a medium-sized county. There's 58 counties in California. We're just south of San Francisco on the Monterey Bay. It's a beautiful coastline. We're adjacent to one of the most wealthy tech sectors, Silicon Valley, and one of the most fertile and productive agriculture centers in the world, the Pajaro and Salinas Valleys. We have some incredible physical resources, our agriculture, our tourism, the adjacent tech sector, as well as a large University of California, Santa Cruz campus. We see in our county, and I'll walk through these maps a little bit, some basic economic, social, and resource inequities playing out around racial and ethnic lines. We have a large Hispanic Latino population, and we see a greater disadvantage in access to high quality education, jobs, housing, etc. These disparities do play out in health outcomes as well. So you can see some examples in the data. These charts have been pulled from the platform. You can see that income is higher in Santa Cruz County than in other parts of California. And the country. However, we have extremely high housing, transportation, and childcare costs. This county is one of the most expensive places to live in the country. And we see that living wage is around $30 an hour for a single person, or $50 for a two-person family with one child. So if that's the living wage that we're shooting for, but we see that median household income, when we break it down by race and ethnicity, we see a large disparity here as well. So you can see on the top chart that the white population in Santa Cruz County make an average of more than 40,000 more annually than our Hispanic Latino population. In the bottom left corner, the green map, that is our income map. Wait, let me see if I'm looking at this properly. Right, so in the green map, you can see that those are the families living below poverty. So our South County residents there's a much higher rate of poverty. It's also closer to our ag producing area. And then you can see on the blue map, the average household income, with the blue being the highest, the darker blue being the highest income, and the lighter blue being lower income. You can see how these two maps adjacent are being compared to one another, show both the income gap in relation to geography, and you can kind of see how those disparities play out. Elisa, would you want to add anything more here?
No, I appreciate the overview. And just to say again, Eva, that this is an example of the power of this platform to create a slide such as this. And anyone in our community could see this, create a slide like it, utilize this kind of information for their purposes.
Thank you. So, this is a tool that has created a lot of impact. Like Elisa mentioned earlier, it has become a central source of information for program planning, for thinking about how to allocate funds and resources, for making data-driven decisions, for in-depth research and reporting, and for advocacy. Currently, we're seeing around 14,000 users using the platform annually. We are seeing that the data is being used in local advocacy efforts around mental health and representative government. We have a focus on spotlighting local relevant data sets, such as housing and transportation, so those can be leveraged by local agencies without having to sift through the 400 data points, the 400 plus data points. And while we have those large data sets available, we also have a commitment to continuously building out our local data and our local reports by having a connection and a strong network of NGOs and private sector allies that we work with to really show a full picture, not just the quantitative data sets, but also some of those smaller data sets that can tell a more complex story of our community. And I'd like to bring on Sarah Adler, who is our website analyst, to talk a little bit more about the tool and how we think about making it most useful to our community.
Great, thank you. And we can jump ahead to the next slide. I think we can go to one more. Perfect, thank you. So I'm just going to talk about a couple of the tools that we've developed through DataShare. So one thing that we've really been focusing on that both Eva and Elisa have talked about is increasing the amount of local data that we're uploading. So we're working on aligning with some of the other data sets that are being collected locally, such as the United Way's community assessment project that Elisa talked about. So working on uploading those indicators that they're collecting through their telephone survey that were available in a PDF report and putting them on DataShare so that people can pull them in and create maps and graphs like Eva showed, and just make that more user-friendly and accessible. We're also working with the county and pulling in some of the HMIS indicators from our homeless management information system to make that data publicly available. as well as working with county parks to pull in some of the county parks indicators and making that data that wasn't previously shared or wasn't easily accessible for everyone in the county to use to incorporate into, as Eva said, some of their funding proposals or program planning. And that kind of thing. We also worked with the county to upload 22 maternal and infant wellness indicators that weren't publicly available before and was data that the county was working on and storing, but now everyone can access this data. We've also kind of crafted these data spotlights, as Eva mentioned. So pulling both qualitative and quantitative data on data share and creating narratives with graphs and figures and qualitative data as well around Black and African American health, housing, transportation, to kind of create a more digestible kind of narrative around those data points. Another thing that we've done is local progress pages. So we work with initiatives or organizations and kind of help them both share the data that they're collecting and show the community what they've been working on. So kind of tracking their progress. And I'll just give two quick examples of this. So one is SafeRx, which Elisa talked about earlier, which is an opioid safety coalition. And we worked with them to create pages that includes both the quantitative data around opioid safety and opioid overdoses, and combine this with quotes from people who have substance use disorder and kind of provide more context to the quantitative data. Another thing that we've done is built a page out for the Safety Net Clinic Coalition, which is a coalition of the safety net clinics and FQHCs in Santa Cruz County. And they are collecting patient utilization data that was previously kind of being shared in their coalition group, but wasn't available and wasn't public facing. So we worked with them to upload that data and make it publicly accessible. So just kind of one quick example, I saw this question in the chat of what are people using this for? So one example is someone that is developing a funding proposal for a new food distribution site or food pantry can look at the data and kind of easily pull data on food insecurity rates by zip code, incorporate data on CalFresh enrollment from our county human services department, pull poverty rate data, and then, people living within a mile of the grocery store, and kind of create this comprehensive report that includes data visualizations and basically easily create a one-pager that they can then use for program planning. And then just another quick thing is we have our core indicators, as Eva and Elisa previously talked about, which is a funding model and movement to achieve health equity in Santa Cruz County. And so basically there was a community roundtable process to discuss which indicators are important to measure community well-being. And those are now available on DataShare. And I'll pass it back to Eva.
Thank you so much, Sarah. I mentioned in our introduction that in addition to being this platform, we are a coordinated organizational structure to get all this work done. So we're a collaborative. We work deeply with our partners to think about how are we going to make decisions? How are we thinking about power relations? Are we using our core values as a standard for making operating decisions? Could I have the next slide, please? And how does this all play out on a day-to-day basis? So our backbone agency is the health department. We have 4 administrative partners, which includes the health department, United Way of Santa Cruz County, our community health trust, and the Santa Cruz County education department, as well as our collective of results-based, our core initiative. The administrative partners really play a role around making operational decisions and moving the work forward. And then we have our steering committee. This is our advisory board of a variety of community partners, the university, HIP, and some other agencies in the county that are focused on health equity. Each of these different partner organizations have a role in governance, in programming, in operations, in resources, and thinking about resources. And we've been functioning in one way or another for about 6 years. Next slide, please. And we continue to think about how we can formalize some of the work that we do. So thinking again about power and equity, power relations exist even in a collaborative structure, and we aim to formalize them as much as possible. There's a quote I really like that thinks about this. It says, if you refuse to define power structures, informal ones will emerge instantly. Not expressing these can be harmful to your work and your mission. So I'm really, as the program coordinator, I'm really thinking more and more about the role of formalizing our structures, our decision-making, and ensuring that our mission to provide equity-centered and comprehensive data is really being driven by these community partnerships. Our operational goals give us a kind of a roadmap for putting in practice all of our decisions and our goals. So we are active in outreach and trainings, in sharing communication roles, in thought partnership for data literacy, and really working through all the stages of feedback, from ideas to a shared solution to those ideas, and then having a feedback on whether or not that worked. And lastly, I want to have Elisa join me on the last slide, please. Thinking about collaboration and accountability, not as a process, but as a destination. So we've been doing the work for 6 years together. There's been ebb and flow of partners. And we know that hierarchies in this organization are dynamic, that authority shifts based on who has the most knowledge and experience in a specific context. Sometimes there's no clearly defined path for holding a specific role, which makes some of these growth points really dynamic. I think we're focused on stewarding and coordinating rather than commanding, holding space and supporting rather than controlling, and really empowering members to do their best work and be their best selves to drive the mission for health equity.
Thank you. Yeah, thanks, Eva and Sarah. Yeah, so I guess just going back a little bit to the timeline and kind of shifting roles in this evolving development and establishment of a community tool like DataShare Santa Cruz County. I think for the Health Improvement Partnership, we started in this role of incubating the concept and creating the collaborative table for which the platform vendor, that partnership emerged, and the governance structure was solidified over time. But I think for HIP, we really recognized at probably 3.5 years in that there was a need for us to evolve from incubator to program advisor in order to allow for other organizations like those that Eva described, our United Way, our Community Health Trust, which is very active in the southern part of our county, where we see the most disparities and need for equity impact, as well as our County Office of Education and the county departments who are active in kind of being the backbone and really the I think have made the most financial commitment to DataShare to this point. We really needed to hand over the reins to a wider group of partners to create that shared accountability and that shared ownership of DataShare. And so I think, as it relates to our DASH work and, how we've applied the DASH approach, we were really looking at integration and, bringing folks into the process and to really share and own the product. So we ended up stepping aside and allowing this kind of broader coalition of administrative partners to move forward into our sort of present and the future. And I think from HIP's perspective, I think this was a question that came up in the chat. Is this just a health data tool? And no, it's not. It's really intended to be a community. All of these indicators, right, that really demonstrate whether you have a thriving and healthy community are far more than just health indicators. I mean, to a certain degree, that's the kind of downstream impact, right, is if people have like certain health outcomes. But what's happening in housing and what's happening in accessibility to parks and food and all these, we know this now, the social determinants, we're using that so much more frequently now. I think these tools like DataShare need to tell a more complete picture than just health data. And so again, this really led us to the conclusion, I think, as a community in general and as an organization at HIP, that it was time to move it from a health-driven tool to a community impact-driven tool. So I think in that process of democratizing the administration governance, we've really made a positive move towards the shared ownership model that Eva described. Eva, any parting words from you?
No, I think we can just open it up to Waldo and questions. Thank you so much.
Great. Thank you to all our speakers for sharing. We do have some questions that have come in. Some of them you've already answered on the fly, so thank you for doing that. But Tyler Harmon wanted to ask Sarah, what data sharing agreements needed to be in place to pull the HMIS data, and was it just aggregate data?
Sorry, I was muted. So for the HMIS data, the county is the backbone partner for DataShare. So I think because they were holding that data and they're the backbone partner, and like they felt comfortable just kind of sharing that data that way. So there wasn't a formal data sharing agreement in place. And then, yeah, so that is aggregate population level data. So all the data on DataShare is not protected health information.
Great, thank you.
And we do have a data committee that makes decisions on what data gets integrated. That's local data. So it went through a decision-making process with the data committee before Sarah would upload it with the county.
Okay, great, thanks. Yvette, you described reciprocal sharing with the community when you are collecting data. Could you talk a little bit about how the community accesses or uses the data in the collaborative that's been collected, or how they participate in the power that the data has provided? I think that you said that the data offered the collaborative the opportunity to get power. So is there any power sharing that you've all explored there?
Yes, so community members might want to contact the person that they met at the convening, or they want access someone that has certain skills or resources, and then that data is available. Is available through, well, just so we are like very like not advanced technology, but we have it in a Google. In Google, they can access the data in Google, but also, as I mentioned, we have a WhatsApp community, because that's what for the community that's what it works. So they in there we interchange of course data that is not HIPAA protected. It's just data about skills and resources that they have available. Mm-hmm.
Great, thank you.
Mm-hmm.
Jumping over to Sarah Zabo asks, and I'm not 100% sure I know who you're asking the question to, Sarah. So if you want to jump in real quick, does your steering committee include community members in addition to members from partner organizations?
So we are in our steering committee recruitment. We, in our last recruitment round, we were pretty clear that we would love to have community members, especially those with lived experience and representative of our South County community. As of right now, we have each steering committee member does represent a partner organization. Some of those members have that lived experience, and I mean, they're all based in Santa Cruz, but we don't have anyone who isn't also representing an agency on the steering committee at this time.
Excellent. Lynn Van Arksdale asks, does the Santa Cruz project support provider referrals or bed capacity management?
I can answer that question, Waldo. Thank you, Lynn. So as we've mentioned, that this particular platform, DataShare Santa Cruz County, is all aggregated data. So it is not patient health information, and no, we do not do referral management. There is information, again, that comes from the hospital systems that, you know, we do have some data points related to hospital utilization, but again, it's not for purposes of clinical care. And what I will say, though, is that we also have here in Santa Cruz County a health information organization, and we are implementing, and this to me is sort of a separate topic, and I've talked to the DASH folks about that we didn't want to go down this, because we do have this community level data platform, but we also are doing health information exchange, and we're working with Unite Us, and we're working with Activate Care and other clinical and social services partners to create that information referral network to help coordinate care for patients. But that is a separate topic for us here in Santa Cruz County. But it's an important question.
Great, thank you, Elise. And I think that Liz also asked, are the hospital systems on board, and are they sharing any patient information, the EMRs, like developmental milestones for children? I think that you kind of addressed most of that in your previous comment, right, Elisa?
Yes, I would just say, to further kind of clarify, the use that the hospitals are currently have for DataShare Santa Cruz County is, again, that aggregate data that they use for their community health needs assessments. So when they do their grant making and their community-based investments, they utilize the information that's available in DataShare to help write their community health needs assessments. In terms, again, of like coordinating care, clinical, et cetera, they're using the health information exchange, which is completely separate from DataShare.
Okay, great, thank you. Great. Well, thank you to all our speakers. We're practically at the top of the hour. We did want to thank you, everyone, for joining us today. And we want to remind you that we have our second session on shared community data ecosystems coming up in July, and the third session, the third and final session on the role of policy and multi-sector approaches, which will be taking place in August. So stay tuned, keep checking your email, make sure you sign up. If you want the recording or any of the other materials with this session, feel free to do the survey at the end, and that'll lead you to the Dash page that will have all that information, and we'll have additional information in the coming weeks. So we'll be releasing the framework as a whole in October at the All-In National Meeting. Please remember to do that post-webinar survey. We'd love to hear from you. Thank you all, and have a great day.